Massage therapy. This type of therapy helps children learn to relax and allow the tissues to heal. Since touch is the first sense to develop, it is important to utilize it in order for the child to grow up to be healthy and normal. One benefit is that it reduces stress, diabetes, ADHD, asthma, ASD, and improved motor function in cerebral palsy. Craniosacral therapy. The therapist will put pressure in areas where they sense that the spinal fluid is being clogged and allow the flow to become continuous once again. There is little research in this area because treatment lacks control groups, but many therapists still use craniosacral therapy because they claim that it helps with colic, ADHD, and feeding difficulties. Osteopathy. The therapist will move the patient's joints for them to help loosen them and to get the child used to how the joints are supposed to move. It has been shown that children with cerebral palsy benefit the most, but it can also help reduce stress in the child that can come from various developmental milestones that they encounter. Hippotherapy, also known as horseback riding therapy. This therapy requires the patients to engage their core, gross and fine motor skills in order to help stay up on the horse. Hippotherapy is most effective for children with autism, cerebral palsy, Down syndrome, developmental, and social and or communication delays. Patterning. The therapist teaches the child the principle of mind over matter. They believe this is possible because of neuroplasticity. Though there is little research to support the patterning, many still use treatment to treat Down syndrome, autism, and brain damage in children. Chiropractic is to manipulate the spine. Though there is little research, there has been claims that infantile colic, ADHD, headaches, and seizures can all be treated. Even with these benefits, parents should be cautioned against using pediatric chiropractic because of adverse side effects.
Manipulative and body-based practices include yoga. It is used to achieve well-being through posture work, breathing techniques, and meditative practices. Positive outcomes from yoga have been shown in children with intellectual disabilities having increased cognitive performance and in children with ADHD who, although already on medication, showed reduced hyperactivity. Another CAM, mind and body-based practice, is called sensory integration therapy. This therapy exposes children to sensory-based experiences such as swinging, joint compressions, brushing, holding, and squeezing. This has helped children with hyper and hypo responsiveness to stimuli.